Good morning, everyone. Adriana Roth here at AW Advanced Aesthetic Training. I am happy to present our last webinar of the year. We're going to be talking about skin analysis, and this is a very important topic. Let me share my screen with you guys. For the ones that don't know me, I've been in the aesthetic industry for about 10 years, for a decade. And I've been teaching and I've been writing all of the courses that you've seen in my center. I'm also an aesthetic consultant. I'm certified on oncology, former educator for NCA. And teaching is my passion and educating. Now let's dive into our class today of skin analysis. The first thing I want to talk to you about is going to be challenges with your clients. This is very important because these are some of the things that I see in the center when we have students coming to our office and are taking classes. And we always start with a good skin analysis. And some of the things that I identify are the following. One, there is not enough education in anatomy. They don't understand the anatomy of the skin. And this is very interesting because if we think about a medical practitioner, maybe a cardiologist, if they don't know the structure of the heart, how could they call themselves cardiologists, right? Same thing with us. If we are teaching skin and we're teaching anti-aging or we are practicing on our clients, we need to understand exactly how the skin works. And that's my second point. How does it make collagen? How does it heal? How deep the layers are. If I'm microneedling and I'm putting needles in someone's face, how deep is it going and why? And what is the treatment doing? So that's a very important part of the analysis, understanding the skin. Number three is focus in what we see outside instead of internal. I see the students looking at each other, very confused. They're looking at the patient's skin and they're seeing just the reflection, of course, of what happens on the skin. Of course, that the skin is the largest organ of the body. And this is where we can see everything that happens inside is reflected here. If you have a disease, if you have problems, health issues, stress, lifestyle, everything is going to reflect on the skin. But instead of focusing on just looking at the skin itself, we want to look inside. We want to see what's happening inside that is causing the reaction of the skin in the outside. The next thing is not speaking with confidence because there is lack of knowledge. There is no confidence. Knowledge is power. And if we don't have the knowledge, we're not going to speak with confidence and we're not going to be able to sell to the patient. Not having a good evaluation, lifestyle, medical, what is happening to the client, if they have any medical history, if they're taking any medications, what type of lifestyle they're living. These are very, very important points when we're analyzing somebody's skin. Some of the factors to keep in mind, we're going to talk about soft and hard tissue. It's a combination of things. It's not just the skin. Number one, we're going to look at the skin quality, the superficial skin. Two, fat loss, if we've lost any fat on the face. Three, muscle atrophy, they become weaker, especially people that are using Botox, it weakens the muscles. And then bone loss, because as we age, excuse me, we're going to be losing bone as well on the face. So let's go into some of these topics. And the skin quality, when we look at the skin quality, we're looking at superficial skin, what we see in the outside, right? That skin is going to look maybe a little bit transparent, a little bit see-through, a little bit weak, a little bit wrinkled, a little bit damaged. We're going to see that right on the quality of the skin. How is the skin looking? What is the quality of the skin? Is it thick skin? Is it thin skin? This way we can determine also what procedure we're going to be doing, looking at the quality, the thickness, and the tissue of the skin. When we're analyzing the skin quality, there are a couple of points that we're going to be looking at. Number one, laxity. We need to identify the source of the laxity of the skin. Is it because they're aging and they don't have enough fat on the skin? Is it because they're losing collagen? Now we're going to see the texture. This is where we see texture of the skin and the loss of collagen. Lack of nutrition and healthy looking skin. You can tell people they're smokers. It just doesn't look glowy and healthy. Thickness, again, transparent color, telangiectasia. If I'm looking at capillaries, veins, that means the epidermis is not very strong, and that means it's thin. It's a thin epidermis, because we can see right through it into the dermis, because in the dermis is where we have capillaries, veins, So this is what we're going to be seeing, that hyperpigmentation. What is the source in order to treat hyperpigmentation? What is the source of the hyperpigmentation? Was it a laser burn? Was it melasma maybe? We're talking about hormone therapy that they may have to be on, that they're having some issues with it. Is it liver? Is it sun damage? There's different types of hyperpigmentation, and they're all treated differently. Some are going to be treated to rebuild the skin and the tissue if it's been burned. If it's post-traumatic, it's different, and if it's sun damage, it's different. So that it's important to understand the source. Erythema, inflammation, reactive skin, red patches. What's causing that sensitivity, right? Bacteria, acne, herpes. Identify what grade of acne it is. So there's a lot of layers. It's not just looking at somebody's skin and saying, well, you're going to need this product or this procedure. We have to really dive in. My consultation with a client is at least 30 minutes because I'm going to go over everything with them, and I'm going to get to that in a minute. In laxatives, the first one that we're talking about, we're going to see very superficially. We look right here underneath the eye, the orbital area is very, very thin. This is quality of the skin, is very thin. We can definitely have some collagen induction. If it's right down here by the jawline, jaw areas, then we're going to see if it's fat, if it's muscle, and what's causing it. Hypersensitive skin, what triggers it? I'm going to ask the patient, have you done any recent procedures? Most likely they've done 100 things to their skin. The skin is overworked. Then it has to be treated as a sensitive skin. What triggered this sensitivity? Well, maybe it's every time I wash my face. Now we're going to look into products and ingredients. What are you using at home that is causing this irritation and sensitivity? Maybe they're using retinol. Retinol will create a lot of sensitivity on the skin. So we need to identify what triggers it, what ingredients they're using, what procedures they have done. Rosacea could be one of the problems that they're having. Very important to understand and identify in order to treat hypersensitive skin, where it's coming from. Bacteria, different sources, acne, hormones, aging. They're 40, they're having menopause, again, hormonal. It could be rosacea. Rosacea triggers acne. There's an acne called rosacea acne, and it's it spreads very, very easy, and it has a lot of erythema. So we need to identify what it is. We may have to work with a medical practitioner because we can only work with the outside. Internally, they have to be seen by a specialist. Hyperpigmentation, as we talk about, identify the source in order to treat it. If they got burned by a laser, I'm not going to burn the skin more using acids. What I'm going to do is I'm going to try to rebuild using growth factors, light therapy, microneedling injection. There are just so many sources that we can use. So how we're going to do that? Lack of vitamin and minerals. This is also something else we can see in the skin. It looks very unhealthy. Of course, smokers, you can see a big difference on the skin, eating habits. Also underneath the eye area and the orbital area, you can see darkness. Sometimes we have lack of vitamins. So these are all factors that would affect the skin. Now, we look at the skin quality. We look at the outside. We feel the texture. We have the different tricks that we learn in school, like squeezing the skin tight on the corner of the eye and then letting go. And this is, if it bounces back quick, you have collagen. If you don't, but honestly, to the eye, I can see, and just by feeling with my hands, the structure of the face, I can see what it is. So looking into fat loss. Fat loss is very, very easy to identify. And we're seeing here a picture of a woman that's 35, young. We see right on the right-hand side, all of the fat on the face, very nice and tight and packed and lots of volume we see here on the outside. So when you're looking at the patient, I'm not looking out here only. I'm trying to figure out and have an idea of what's happening inside, right? 45 years old, 10 years later, now we start seeing more laxity, especially down here in the jaw area, because we're losing fat. And 55, very little fat. Now we're seeing a lot of laxity. Understand, as an esthetician, this type of laxity You can do radio frequency, you can do HIFU, you can do microneedling. It's only going to work with skin quality. It's not going to lift. The skin has to go somewhere. This is when we work with a medical practitioner, and we recommend that they get some fillers, because the fillers are going to replace that fat. There's no base underneath. There's nothing where the skin can, there's no a base where the skin can sit. There's just sagginess because that's gone. So we need to do some fillers. And I want to tell Miss Mary, in addition for me to me working with the quality of your skin and improving it, I need you to see a medical practitioner. Maybe you already work with somebody, and we're going to do some fillers. That's going to just enhance what you have done. And I have a picture here. If you guys want to take a picture, you can take a picture of this, just how the fat is divided into the face area and how that loss of fat is going to affect, especially the lower face. This is what we're going to see it more under the eyes, in the orbital area, mid-face. Then we start seeing some lines on the forehead as well. So this is great. When you look at a patient, then you can see this is where we're at, and this is what we need to do, because nothing is going to replace this fat, only fillers. Muscle atrophy, or just muscle to become weakness. As we can see, we have so many muscles on the face, and you should know every single muscle that is on the face, again, the anatomy of the skin, and they become weaker with throughout time. The thickness is not the same, the tension is not the same. So we can now visualize also that the skin, the face is not looking youthful and good. And this is when we're going to do maybe some HIFU that targets the muscle, high focus intense ultrasound that's going to help to tighten SMAS layer. We can do microcurrent. It also works with the tension and making those muscles stronger. We're going to see also here the bone loss. We also lose bone as we age. So when you look at a patient, now we're going to look at the bone, especially again, jawline. You can feel, you can see also weakness. You see how weak it is. And it's just easy to identify as well. On this picture, I want to show you on the left-hand side. I'm sorry, I just moved my picture. On the left-hand side, we're going to see here a youthful skin and the fat. On the second one, again, fat loss. On the right one, we're seeing muscles. If you can see, the muscles on this left picture and on a young face and here on an older face are completely different. They're very thin. Right here, we can see your zygomatic as well. They're just very, very thin, and they're not strong enough, especially people that use Botox. It makes the muscle not work because it's paralyzed. Therefore, there can be a little bit of atrophy. And I see this a lot on the eyebrow lift that people do, because it starts coming down. They do an eyebrow lift, the eyebrow and the lower part of the eye as well. Now, on the right-hand side, we're seeing bone and bone loss. And we're seeing again, right on the jawline, very weak and very undefined right here, very weak, not a lot of definition. Also, the eye socket becomes more hollow, and we can sometimes see darkness around the eye area. And people will ask, I hear estheticians saying, well, I have a cream that works for that, but creams are not going to do this because this is hollowing of the area. And now we're starting to see that darkness under the eye. It's really not the skin texture, is the loss of the bone. Mainly 50 years and older, easy to identify in the preorbital area and jawline definition. Some of the specifications on a good skin analysis that I want to go through with you to analyze. Number one, your forms. Have them fill out an intake and aesthetic form and go over with them. Why is this so important? This is where I'm going to see if they have medical problems. If they have a medical history, any condition, then if, you know, we're not doctors, you can go on Google and you can see effects of lupus on the skin, and it's going to tell you hypersensitivity to the sun because of the medications that they're taking. That's just an example. Second is going to take me on the aesthetic procedures if they've done any type of procedures. So what procedures they've done, because this affects also the skin. It can become hypersensitive. It can become overworked. It can become thin. They're just hyperpigmented. So aesthetic procedures that they have done. What medications are they taking? Again, go on Google. They're taking Plaquenil. Plaquenil is for the immune system. And this creates hypersensitivity to the sun. So now we know that there's a medication that they're taking, and we can tell this patient we're treating hyperpigmentation. The medication is not helping. And while you're on the medication, you're going to have to really be mindful about being on the sun. So these are things that we can go over with them. So the importance of going so deep into a medical history, I can't address enough, because this has a lot to do with the skin. Lifestyle. What do they do for living? She's a tennis player. I'm trying to work with her hyperpigmentation. I'm not going to do any acids. I can't have a risk of someone who's out there every day playing tennis. So what do they do? What is their lifestyle? How do they live? I'm at the casino every night. I'm a poker player. Okay, lots of smoke, lots of damage. We're going to have to work on antioxidants for the skin to fight the free radicals. So lifestyle is very, very important. The procedure, any procedures they had done over the course of the year, what procedures have they done? Even, throughout their lives, they have face implants, they had fat grafting, they had lasers, they have microdermabrasion. What have they done to their skin? Because this is also going to tell me what it is. And sometimes I just look at the skin and I tell the patient, you had a laser done, right? They go, how do you know? Because I see on your skin, the structure is not the same. It has changed. I had a doctor, I said, doctor, you're having some problems with your health, any inflammation? She goes, yes, I actually have. I think it was RA. She goes, how do you know? Because your skin, there's a lot of capillaries, there's a lot of inflammation. So there is something happening on the body. Somebody who does drugs and abuses drugs. I had somebody who applied for a job, and I said, this person is in drugs. Somebody said, how do you know? The skin, it shows me. So you don't even have to ask, you will see everything on the skin. Medications, we talk about these, look at the side effects on the skin, if they're taking any topical, ingesting any medicine or using any topicals. Medical, look at the illnesses, side effects, timeline. When did the problem started? Was this last year? Was this 2 years ago? Was this when you were a young person? I want to know when the problem started. Is it progressing? What is triggering? When do you think it becomes worse? Because this is going to help me understand what is the problem and what is the trigger. And if they tell me, I get these every time I drink alcohol, I get these breakouts. Okay, so I'm thinking there's got to be maybe some rosacea in there, because rosacea gets triggered by alcohol. It gets triggered by the sun. Every time I go to the sun, my pigmentation becomes worse. So we're talking about sun damage. So anything that it's happening, when, how it happened, when it started, when do you see it getting better, when do you see it getting worse? The next one will be analyze the skin, thinking inside the box. I'm going to look at the skin and I'm going to look inside. What is happening? We'll have loss of collagen. What is not making those fibroblasts not make collagen? How can I increase that? Whatever problem that they have, I'm going to be looking inside. They have the laxity. It's the muscle. It's muscle layer. They're getting older. The muscle needs to be tightening. Okay, HIFU. It's going to be great because we're going to create some tightening. So I'm picturing in my head. I'm picturing in my head the inside of this person. I'm trying to picture the muscle, what it looks like. I'm feeling, I'm analyzing, I'm going under the lamp. I'm putting the customer, under the lamp. So just analyzing what is happening. Don't just look at the inside and the outside, look at the inside and what is happening. Feel the texture with your hand, the bone, the muscle, the fat. You will feel the skin very tight. If it's fat, it's going to feel deflated, that, there's no volume, and you'll see it to the eye. So feel the texture, look at the skin. This analysis takes a long time, and it's interesting. I get emails from professionals that says, well, I have a patient that has this problem with her skin. What do you think? It's impossible for me to say anything. I have to call them and I have to start asking all these questions. Any medical problems, any medications, any procedures they've done, what products are they using at home, what treatments are they currently doing, when did it start, are these pictures new or old, is it getting worse? I mean, so many questions that I have for this patient in order for me to do a good skin analysis and assessment. If we have a good skin analysis, we're going to have a good approach. Other than that, the procedures that you do are not going to work because we don't understand what is happening. This brings me To treatment plan. Let's put a treatment plan for this patient. What are we going to do? What are the procedures? Always you treat one thing at a time. We can't treat everything at the same time. So what are we going to focus on? The more you analyze different skin types, the more you're going to get experience, the more experience you're going to get. Now, I had a doctor that worked for me who did not do anti-aging and was learning. And he says, when am I going to be able to analyze the skin the way you do? I said, when you see 100. You got to see 100 skins. The more you see, the more you analyze, the more you understand. Because maybe you had somebody with diabetes. And now that you see their skin, you're going to remember, you're going to have that picture in your head. And next time you see somebody with that same skin, you're going to ask them, do you have diabetes? Yes. How do you know? Where your skin reflects. Do you have lupus? Do you have, did you get a laser? Whatever it is, the more skins you see, the more experience that you will get. You should be able to look at your patient's skin and tell them exactly everything that is happening and why it's happening, even stress, stress. I had somebody that her husband died. Her skin was very stressed, but it was coming from her emotional being. And I did some treatments and I finally said, nothing's going to change. She was walking around with sadness, with stress, with pain, and that was reflecting on the skin. And I had to have that talk with her. So just analyze as many skin as you can, and you're going to be an expert in skin. Treatment plan. So we're going to talk about the treatment plan. What can we treat? So we're not going to treat everything at the same time because you can't do sensitive skin with hyperpigmentation, with acne all at the same time. So we're going to put a plan to achieve the best results for your patient. Not only that, but they're going to follow through and they're going to continue to come in. When I said, Miss Mary, this is the plan. We're going to have to start treating your skin as a sensitive skin because right now it's very inflamed, it's very irritated, and we're going to navigate through it. Once we calm the skin, we're going to move to the next level that's going to be hyperpigmentation. I know you're struggling with this. We're going to brighten your skin, and then we're going to work with your collagen to make the skin thicker and have more collagen production. So have a plan for your patient that they're going to be encouraged, excited, and they're going to want to come to see you and complete this plan. In order to get results, you must have a good understanding of the skin and the anatomy of the skin. That's key. Without that, you can have a good treatment plan and you can have results. Don't just treat the outside. If they're having medical problems, it's very important that you refer out to a medical practitioner or that they continue to be under treatment. If it's hormone related, it doesn't matter how many treatments you do, as long as the hormones are not balanced, they're going to continue to have the same problem. If they're having melasma is also hormone. It's a problem with hormones, the same thing. It can improve, but it's not going to go away. And if there are medications that are affecting the skin while they're going into medications, we can only promise to continue to maintain the skin healthier and help with some of the side effects, but it's going to continue to happen. So very important that you sit down with your patient, work with a medical practitioner, and that they are under treatment on any conditions that they have. Keep in consideration the lifestyle to reach the goals. See what they do for living before you do the treatments that is going to be suitable for them. And know your brands and ingredients and what's beneficial for the skin. Because we can have a great analysis, we can have a great plan, but yet we don't understand the ingredients on the products. And now we're going to start recommending products from the brands that we work with. And we might put them in a product that maybe has tranexamic acid or any type of acid for somebody who has rosacea. Now she's having more problems because there's more irritation because we're giving them the wrong product. So know your brands, know your ingredients. And that's one of the next webinars that I'm going to be putting together. Not so deep into ingredients because we're not chemists, but just to understand what ingredients are good, what we can give your patient to treat certain things. So that's something that I have in the works for you guys. The last thing will be confident. Education is power, and confidence comes from knowledge. When you don't feel confident about something, it's two things. One, you're not prepared. Two, you don't have the knowledge. Those are the only times that you're not going to be confident about what you're doing. So it's very important that if you're not understanding the anatomy, and every state is different. I want to speak for my state, which is Florida. It's only 220, 260 hours. That's not enough to understand the skin. So we need to get more education. Invest in your education. Start going to trade shows. Some girls go, well, Adriana, trade show for medical trade show, it's $500 a ticket. It's worth every time. You're getting the best education. Go and take all the classes for the next 3 days and learn. You're getting doctors that are teaching you, people that are well qualified that are teaching you. Find schools, go on YouTube, start learning about the skin, how it works, anatomy, what it does in order to be having a good assessment. This is what we need to start making changes today, to change our mindset, to have confidence, to be able to speak to others, to be able to teach. And I'm an esthetician. That's my initial background. Then, I had other certifications, but that was my original background. And I'm able to teach a lot of skin and a lot of different people in different areas and different professions. Why? Because I learned the anatomy, because I understand the skin. So please give me a call if you have any questions. I hope that this was helpful. I'm always here. And if not, I have a good group of people, a team that works with me, and they are amazing. You have Sophia, you have Lena, you have Armando. So we're all here to help you. Let us know if you have any ideas of other webinars that you would like to hear. This is what we're here for, to educate you, to teach you, to coach you, and to grow together, because this is what we're supposed to do on this earth, right? To just help each other and support each other. And thank you again for your time. I hope you have a great day, and it was just great speaking with you this morning.